Low-profile, super-elastic DynaNite CT nitinol staples are available in 2 sizes, designed to accommodate a range of patient anatomies. Before closure, measure the thickness of each sternal half. To ensure secure fixation without compromising the posterior cortex, choose a staple that is at least 2 mm less than the thickness of the sternum. With FiberTape sternal closure completed, the DynaNite drill guide is then positioned, centered and perpendicular, setting the stage for precise implantation. The DynaNite CT system features a specialized positive stop drill bit designed to safely drill into the sternum, preventing over-penetration to protect underlying tissues. Using the loading device, the DynaNite staple legs are adjusted to match the width of the drill guide. The staple leg should be in parallel or near parallel position to facilitate compression of the sternotomy once inserted. Once seated, the device is released, allowing the nitinol to return to its original shape, delivering targeted, active compression to the sternal body. A tamp ensures the staple is fully seated. Additional staples can be placed as needed. As an adjunct to FiberTape sternal closure, a minimum of 2 staples is recommended to optimize fixation and enhance resistance to lateral distraction of a median sternotomy. DynaNite CT nitinol staples and the FiberTape sternal closure system deliver the strength, compression, and flexibility needed to optimally personalize sternal closure for every patient.